Hi, everyone. Thank you for your patience. Sorry for a little late start there. We want to welcome you to the HR for Health, How to Reopen After COVID-19 webinar. I'm Kimberly Fuller. HR for Health knows that there are still a lot of questions out there about how you are supposed to reopen your practice, rehire your employees, and connect with your patients. And so we're here today to try to answer as many of them as we can. A little bit of background, HR for Health is a cloud-based human resources software developed to simplify human resources and healthcare practices while minimizing legal risk and ensuring compliance with federal and state laws. Our esteemed presenter today is Ali Oromchian. Ali is co-founder and chief executive officer of HR for Health and also a founding attorney of the Dental and Medical Council law firm and one of the nation's leading legal authorities on topics relevant to doctors. So now, without further ado, I would like to hand it over to Ali Oromchian.
Perfect, Kim. Thank you. Good morning, everyone. I hope you're doing well. It is a crazy time for a lot of different reasons. As many of you know, there's a lot of talk, and we are all sort of getting ready to reopen up. But things have started to change a lot around the country. A lot of the shelters in place and have changed and whatnot. And so now, we wanted to give you some material in advance of what we think should be a few weeks as you plan ahead to opening up, depending on where you are in the country. I know some states have already kind of gone down this road, and we'll talk about that. But I want to start off by really just kind of saying one thing, which is this seminar that we're doing right now is not intended to be our recommendation that you need to open up immediately, right? By no means are we saying that. Every county, every state, every other locality is coming down with their own rules. They're coming down with a lot of different, programs and things that we're going to talk about today in many different ways. And so this is just things that you need to start preparing for and thinking about as you get ready to open up. And that's really what today is about. And we're going to go into a lot of detail about some of this material as we speak. So as of March 16th, just to kind of give you some quick background, as of March 16th, a lot of optometric, dental, medical, veterinarian organizations basically said that everyone should stop providing non-essential care, as most of you know. And yet provided some flexibility for healthcare providers to provide patients who are in need of emergency services. And so a lot of you who have been doing that, that's fantastic, and you should continue to do that if the need is there. What really the goal of these localities has been is to stabilize and restart the healthcare world, if you will, in a safe way. Because as many of you have seen across the board, there's a lot of information about the safety of hygienists and the safety of dentists and the safety of veterinarians and optometrists and whatnot. And organizations like the AOA on the optometric side came down on March 17th and basically said, look, eye exams are okay, and you can open up again. Those things have been kind of changed a little bit, by the counties and the states, but there's a lot of information out there that you need to digest. Obviously, we're doing this nationwide, and so we are not going to be able to go into very much detail from a locality perspective, but we are going to share a lot of information. Here are some things I do want you to know, though, because there's a lot of push right now to open up, a lot of stress. You may feel it internally, you may feel it from your families, you may feel it from your vendors and people who you owe monies to who are not being as flexible as maybe they should. But I want to share some statistics with you that a large dental management company put out. And I think this applies across the board, whether you're an optometrist, a physician, a veterinarian, or a dentist. But here's some information that they put out, and I'm going to read here from my notes. So 71% of 1,270 adults that they polled, that were their patients, reported that they were uncomfortable visiting the dentist for checkups, elective treatments, or other non-urgent care. Right? That's a big number, 71%. And this DSO, by the way, is mostly in the East Coast and the central Central America. So a little bit in the mountain time zone as well, very little on the West Coast, but you can kind of get a sense of the fact that it's a good broad audience. 77% of those folks said that they were concerned about not only their personal health and safety, but also those of their family members. So maybe they're taking care of an elderly person, a parent or someone else, and they're worried about them as well. And only 42%, now this is very important, 42% said that they felt confident that their dentist was ready to prevent the spread of COVID-19 to, in their communities. Now think about that. Just under half of your patients may think that you're not ready for that. Now, this is an important stat that we're going to talk about a little bit later as we talk about how to prepare for your first day back and all the things that maybe patients are looking for. And we're going to talk about some resources and whatnot. But those are pretty amazing statistics for you to kind of digest, because these are the things that really patients are caring about. So here's what we're going to talk about today. We're going to go through shelter-in-place announcements. We're going to then talk about how and when to bring back your team. Very, very important. We're getting a lot of questions about that. How to manage patient interactions as you're getting ready to open up your office. We're going to go into great detail about that. And then equipment and recommendations. And then we've got a really great resource for some PPE at the very end that I know a lot of you are very stressed out about because a lot of vendors are running out. We have sourced somebody that we're going to provide you at the end so that you can get some of the PPE that you need. I'm going to, as you guys know, I don't usually like to look at my notes, but there's so much material here that I'm going to be looking at a lot of my notes to make sure that we get everything down and I don't forget anything because there's so much to go through. So I apologize for that in advance. But let's talk about the shelter in place, and let's talk about shelter in place fatigue, because it is out there and it's real and you're hearing it from everywhere. Maybe you're fatigued. Maybe your consultants and coaches are fatigued. Maybe your family's fatigued of you. I don't know, but there is this feeling of when are we going to get back? When is it going to get normal again? And how are we going to do it? On Monday, we did a Q&A with an HR expert from this California Dental Association. It was a wonderful Q&A. We went into really deep questions that she answered. I interviewed her. If you still have some questions on the HR side, we're going to go through some today, but I'm not going to duplicate what happened on Monday. So go find that webinar and that Facebook Live. It's all over our social media, whatnot. It's been shared a lot. Please go and check that out because you'll get a lot of great information. But really, what we're talking about with the fatigue right now is that there's this push, this almost stress to open up immediately. And what's happening across the country is very interesting. So some states like California have teamed up with Oregon and Washington. And now as of just this week, they have also brought in Nevada and Colorado into their kind of pact, if you will. And then states like New York have kind of teamed up with Connecticut and New Jersey and some other states. And other states sort of in the middle of the country, like Texas and Oklahoma and Illinois, are kind of starting to do their own thing and kind of figure out what to do. And the reason I bring this up is because there is a trend, right? There is a trend that we're going to talk about. We're going to talk about really 3 states right now because we can't get to all 50. But there's a trend of following a certain protocol. And if you heard the governor's announcement yesterday, he basically set the stage for opening up. And he said there are 4 stages for reopening now, okay? Now, he didn't give a specific date, but said there are 4 stages, right? So stage 1 is the stage that we're currently in. So here, only essential businesses are allowed to operate, including practices such as encouraging face covering and other things by residents. This is the kind of the environment that we're in. That's where we are today. Phase 2, or stage 2, as he calls it, is the opening of lower risk workplaces. Okay, so lower risk. So the examples he gave were retail curbside pickup, manufacturing such as toys, clothing, and furniture, some offices where telework is not possible, and then some schools and childcare facilities. Okay, so So now, with all of that, he gave a big caveat, which was that employers and employees should really push that non-essential workers stay home and telework or whatnot. Okay, so this, he said, could be weeks, and long, and probably not months long. So that's good news, because if we are following some of the other information that's coming out of the counties or whatnot here in California, at least, we know that this might last all of maybe May, maybe a little bit less. We don't know. Stage 3, right, is the higher risk workplaces, right? So personal hair care, nail salons, entertainment, sporting events without audiences, okay, churches, and other activities where there's close proximity. Now, this is, the governor said, months away, not weeks away. He said this is likely months away before we get to stage 3. Okay, stage 4 is the higher risk workplaces, right? Concerts, conventions, stadiums with live interactions, all those things. So the question, I think, is that you guys are probably asking yourself is, okay, well, where does my dental, optometric, physician, or medical office, veterinary office, where do I fit? Am I in phase 2 or stage 2? Am I in stage 3? Or am I stage 4? Well, if you listen to all the fear mongers out there, you would assume you're in stage 4 because of all the high risk aerosol and droplets and everything else that we're hearing about. And that may be the case. We may end up being in stage 4, and we may be several months away. Because remember, he said stage 3 is months away, not weeks away. So this criteria is being duplicated in other states. Okay, we know the 5 that are tied to California, of course, but there are other states that are also trying to model this. Okay, so why is this important? Well, this is important because this is where your voice matters, right? This is where your voice absolutely matters. And so I want you guys to take out your phones. You're going to get a copy of this if you want, but this is a link, right? A very important link for those of you in California. This is a link where you can go and give your input to the governor's office regarding where you believe your profession falls into, right? And so I would encourage all of you, if you feel strongly about being in stage 2 or stage 3 or stage 4 maybe, is to go on there and give them your thoughts about why you're in which stage you should be. What we know is, after having kind of called the governor's office and finally gotten through, the information that we have gotten is that they are going to put out a more detailed assessment of where various businesses fall in these stages. Now, we talked to someone very low level. I don't know when it's going to come out, but they said they are working on something to put out. So before they put that out, which may be in the next few days, the more information they have from all of you, probably the better. Of course, try to keep it positive, stick to facts and things of that nature. But this is a great way of giving some feedback back to the governor's office here in California. And remember, by doing that, you may be impacting really, not just here, but you may be impacting Oregon, Washington, Nevada, and Colorado as well. So for those of you who are outside of California, you may want to go on there as well and give your input, because all the states are coordinating their efforts. Now, let's go to New York, for a second. So New York has done something very similar, but slightly different. So on Sunday, Governor Cuomo outlined a framework to reopen New York and to basically create a scenario of what this new normal is going to be like. And he also did it in phases. Okay, so phase 1 is the current phase that they're in, which is complete shelter in place. Phase 2 is going to be, again, opening up certain industries on priority levels and risk levels. Okay, so those, he was a little bit more vague about it, but basically said those businesses that are more essential and have lower risk of extending the COVID-19 kind of epidemic are going to be opening up there. And as long as they have infection control protocols in place, right, they may be in phase 2. So that's in that way, it's a little bit more detail and maybe an opening towards dental offices opening up and optometric offices and veterinary offices opening up in that way. Maybe. We don't know. But that's kind of what he talked about. And then he talked about the other stages, of course, with childcare and whatnot kind of coming down a little bit later. So the thing to remember is obviously New York is at the center of all this. And so for them, they have an intense interest in making sure that there's no hot spots or whatnot. And so we do believe that, because states here on the West Coast ended up kind of acting a little bit quicker and were able to contain the epidemic a little bit faster, they may open up sooner than some of the states near New York, like New Jersey and Connecticut or whatnot. So we don't know, but they are trying to coordinate those. They're trying to coordinate major activities. So now let's go to Texas as the next state. So Texas, on the 27th, right, of April, Governor Abbott issued an order which basically permitted some businesses to begin opening as of Friday, May 1st. So coming up just in a couple of days. So those were retail stores, restaurants, movie theaters, malls. So now they can only operate at a certain capacity. I think it was 25% of what they're able to do. So what that means, how they're going to actually do that, we don't know, but they are going to be opening up on May 1st, but with minimal capacity. Some other things like state museums and libraries may be provided, again, with limited capacity. So it's just something to think about. Now, the ones that are going to be closed on phase one, unlike some other states that you've heard about, like Georgia, public swimming pools, bars, gyms, salons, massage establishments, those kind of things, bowling alleys, those are still closed in Texas. Which is good. So what we think is that, they're taking kind of a middle of the road approach. They're not being as sort of liberal, if you will, as Georgia is in terms of opening up everything very quickly. They're not being as conservative as New York and California either. They're kind of just focusing on something in the middle and then testing it to see if it opens up. So I think depending on where you are in the country, you should expect that your state is going to start implementing one of these kind of strategies. So absolutely make sure you stay tuned to that. Let's talk about PPP announcements and kind of what's happening with that, because this has been a great amount of stress for so many of you out there, and such a small percentage of you have gotten this. So as many of you know, the president signed the second stimulus relief bill, which opened up another $300 and change million out there. That is, that is great, except that from what we've heard is that most of this money, this $320 billion, has already been accounted for, if you will, based on what the banks are telling us on their applications. In fact, some banks are just taking information, but they're not really taking applications anymore because they're not submitting anything anymore to the SBA. So if you've submitted through any of the larger banks, hopefully your name will be called. If you haven't and you're working with a community bank, we have seen that the community banks have done a really great job of getting applications in. I will tell you, there are two organizations. They're fintech organizations that are, they're not traditional banks, but they're kind of startups in the financial world. And one is called Kabbage, Kabbage. It's a funny name, I know. And then Lendio, Lendio. These two entities, among some others, are legitimate companies apparently that are pushing a lot of applicants through. And we've had some doctors use them and actually get their applications in like very quickly. Within like 7 days, they've gotten them in, and this is actually very recently. So you may, if you're hitting a wall with your bank, or they're kind of giving you the runaround, then you may want to kind of go look at some of these institutions as well. They might be good alternatives, but I will tell you the money is probably already accounted for, but it may not be too late to do that. So So try, it definitely is worth a try for sure. Now let's go into some specific questions that we get. So the first one is, one of the frequent questions is, the CARES Act excludes from the definition of payroll costs any employee compensation in excess of $100,000. Does that exclusion apply to all employee benefits of monetary value? So this is an important question, and I'll tell you why in a second. But the answer to this is no. Okay, so no. So the exclusion of compensation in excess of $100,000 annually applies only to cash compensation. Okay, not to non-cash benefits. So that includes defined benefit plans, defined contribution and retirement plans. So keep that in mind, including group healthcare coverage and things of that nature. So keep that in mind as you're kind of working with your CPA through this. This is directly from the SBA late last night. They brought up some of these questions and answered them. So because there were so many people were asking questions. So the annual salary of $100,000. You can actually apply more to it if you, for example, have high income earners and they are getting, other non-cash benefits as well. So important. Do PPP loans cover paid sick leave? Okay, so I want to be clear about this. So there are some states like California, Massachusetts, and some others have state sick leave laws that are in play, and then some states don't. Okay? Those are still intact. The federal rules that were just passed under the FFCRA, the emergency sick leave and the emergency FMLE leave, those are in addition to the state sick leave rules. Okay, so those are in addition to the state leave rules. Why is this important? Because the PPP loans can be used to cover sick leave, but the state sick leave. So if you use that money for the federal sick leave one, the emergency sick leave and FMLE, then you would be double dipping if you try to also take the tax credit on the quarterly tax returns that you can. So you can't do that, right? So you can't do that. So here's our advice. Again, work with your CPA on this, but here's our advice. Our advice is use the PPP loan to pay out your state or local county sick leave laws, if there's any left of any benefits left for your employees. And then when you have the federal government emergency sick leave of FMLE, then give that to them and then take the tax credit on your quarterly tax returns. Okay, so two separate things. You cannot double dip, all right? You cannot double dip. So you can't use the PP loans for the emergency sick leave and FMLE and also take the tax credit. So kind of just keep that in mind. Now, do lenders have to use a promissory note provided by the SBA, or may they use their own? Okay, this is super, super important because one bank in particular, but a couple have done this, mostly on the East Coast, but few here, few on the West Coast as well, where they are using their own promissory note if they gave you PPP money. And what you probably uncovered is that promissory note is more restrictive than the SBA guidelines, right? So that you have to be aware of this, right? You have to be aware of this because I know many of you are hoping for the forgiveness. It's absolutely reasonable why you would. So you have to make sure you read your promissory note very carefully. Don't rely on the SBA rules or what you've heard, from me or other places. If you've gotten the money, look at your note because that's a contract between you and your bank. And if you don't meet all of the regulations that they have in there, then you may not get your loan forgiven. Now, many banks, right, a large majority of banks are using the SBA guidelines, and in their promissory notes say that whatever the SBA says is what we're going to use as our criteria for forgiveness. But a few banks have gone and become more restrictive, and so you have to be aware. And when I say more restrictive, they are very restrictive. I mean, one note that I saw for a client said that they could not fire anybody through the end of the year. For the end of the year. One said September 30th. I mean, these are massive, massive changes to the promissory notes that, or the guidelines that the SBA has put out. So just kind of be aware, because we all hope that patients come back and there's the demand that will be there. And for many of you, knock on wood, I get the feeling that there is that optimism because you are communicating with your patients. So, it's not necessarily dire, but we don't know what the OSHA guidelines are going to be. And we're going to talk about that in a little bit. So your revenues may be less, so you may end up having less employees. So just kind of keep that in mind as far as the loan. Now, the next question is, does the cost of housing stipend or allowance provided to an employee as part of the compensation count towards payroll costs? And this is really important because, I was so happy to see this from the SBA, because a lot of you from around the country have been asking us this question, which is, my RDA or my optician is, hasn't had money coming in. They got denied unemployment, or unemployment is taking too long. They're being kicked out of their house, or they're being kicked out of their apartment. What can I do for them? And so just so you know, you can provide an allowance for your employees in terms of housing stipend or otherwise, and it will be counted towards your payroll cost, when you're doing your PPP calculations for forgiveness. So if you've gotten your money and you haven't used a calculator or whatnot to kind of play with it, our resources page at HR for Health has a calculator we created that breaks it down by payroll period and whatnot, and you can start to insert some of this data in and see how much of your loan potentially will be forgiven. But this is a nice little perk that you get. Now, I know some of the questions we're going to get is, well, can I use this for myself, right? Can I use it towards my own housing stipend, or for my own allowance? Can I increase my own? And as I've mentioned many times, you will have to be careful with the federal government. You have to be careful with these monies. Through the CARES Act and the FFCRA, the federal government has created task forces to combat fraud, right? And they will be looking into what the banks are doing. They will be looking into what you are potentially doing. And so if they feel that you're using this money potentially more for yourself than you are for your team members, because remember, the goal of the CARES Act was to save jobs, not necessarily save businesses, was to save jobs. And so as a result of that, if they find that, one, you may have to give the money back. That would be kind of the easy thing. But the second thing there may be other legal repercussions coming from it. So just be very, very careful. Okay. All right. Let's move to how and when do I bring employees back? So I want to make a couple of quick comments before we really jump in here. So one is that a lot of you have been asking me, if I have my team members, doing kind of just general tasks at home for the office, figuring out protocols, attending webinars, doing the sexual harassment training, doing all of those kinds of things, do I have to pay them for these things since they're just home? And the answer is yes, you do. You should be paying them hourly for that work. And so keep track of it. If you're an HR for Health customer, it's super easy for them to insert it in, of course, at home. Even though the software is IP specific for the office, they can put in their time, as many of you know, and then you or your office manager can approve it. So you have really good tracking of their time out of the office. And then if you're not an HR for Health customer, then you may want them to, handwrite it and on a piece of paper or whatnot, and maybe email it to you or fax it to you, or maybe text message it to you. But you want to save that somewhere safe. Don't just leave it on your text messages. But doing it kind of electronically, doing it kind of in a safe way is very important, because remember, they're still working, right? They may not be working the way you want them to work, as a hygienist, as an optician, as a nurse, but they are still working, and so you do have to pay them. Now, let's start with the basics, the new hire documents. This is important for two different kind of groups of folks, right? If you are in category one, which is you've terminated all of your employees, if you've already terminated your employees, regardless of whether they were furloughed and then terminated or just terminated, but if they've been terminated or laid off, you need to give them all new hire documents all over again, okay? And you need to have them sign the employment manual. You need to have them sign sexual harassment forms, depending on what state you're in. On average, there's 12 to 17 documents that each employee needs to sign, right? And so if you've never done it before, then use this opportunity, this once in a lifetime, hopefully, opportunity where you have a lot of time on your hands, and get your HR house in order so that you can make sure that when they come back, they are signing everything that they need to sign, okay? And if you don't have an employment manual, let HR for Health know. They'll make sure you get a new employment manual with all these new rules and protocols and everything in place that has now come out in light of COVID-19. But if you've terminated, you need to make sure that they sign all these documents, right? Just as if it was day one of their job. Now, one question for that first group is, well, do their benefits start over? Do I backdate it? That's a personal question that you can answer yourself. It all depends on what you're comfortable doing. Our recommendation is that you should give them, you should retroactive their start date, in essence, to when their original start date was for benefits purposes. So, for example, if you were giving, let's say, 2 weeks of vacation after 5 years of service for you, which is very kind of a typical thing these days, then if they've started working for you 6 years ago, then let them get that benefit, right? Don't make it so that they start with zero tenure now after you reopen. But for legal purposes, their new start date will be the date that you're bringing them back and you're hiring them, okay? Now, if you're in the second category of folks who did not terminate their employees, but rather furloughed their employees, and so they're still on the books, you haven't terminated them, you haven't given them final paychecks, you haven't done any of that, then you have a decision to make. Do you kind of update all their records? Because if they've been with you for a while, then it's time to update it. So you can do that. But what I would definitely do, regardless of whether or not you want to update their new hire documents, is make sure they sign a new employment manual. Okay, make sure they sign a new employment manual that has all the latest and greatest information in there, because there are a lot more requirements now in terms of documentation and things of that nature. And also, obviously OSHA requirements and things that they have to kind of keep in mind of. So it's important to kind of have that there and available for the employees. So you're probably fitting in one of these two categories. Obviously, if you're an HR for Health customer, super easy. You can just, make sure that the documents are updated. Our team will help you, and then you electronically send it to them. They fill it out at home, sign it electronically, send it right back to you through the system. You don't have to worry about paper or anything else. If anybody's missing anything, you'll know. But if otherwise, you may have to do it in paper and collect them and do those kind of things. Okay. So new hire documents, very, very important. Now, a big topic. I probably handle 20 plus calls a day just on this topic alone, which is how do I hire and how do I avoid liability in my hiring? Okay. So generally speaking, when you hire or onboard just a few employees, or you do it on a rolling basis, there are these risks. There are these risks of not integrating the right people or doing it not in a systematic fashion. And what I'm trying to really impress upon you, that it's important that you come up with a system of hiring if you're going to do a slow rolling basis in terms of hiring. So it could be tenure, right? The folks that have been with you the longest get hired back first and maybe get their hours back, and then you slowly kind of go back and hire everybody else. You could do it based on just performance, right? You have an A team, and then you have a B and C team maybe. And so the A team, however many people that is, maybe they come back first, and then the B team, and so on and so forth. So you could do that, okay? What you want to be careful of is to pick and choose who you're bringing back that's based on a criteria that's not solid, right? So if you get pushed, you can't explain away why you didn't bring back someone who is above 60 years old, or someone who's pregnant, or someone who's in any other way not your preferred person to bring back. Now you might say, well, the older employee, the pregnant employee, the employee with AIDS or HIV, the employee that's immunocompromised, that has asthma, that has diabetes. I don't want them back because the reality is that they're high risk and they might get sick. And you're absolutely correct. However, the Department of Labor made it absolutely clear that you, as the employer, are not allowed to either delay the start date or in any way change their job benefits or hours or pay or whatnot because of age, pregnancy, disability, or any immunocompromised kind of scenario that we've been talking about. So how do you handle that? Right? How do you handle that? Because I know a lot of you care so much about your employees. You may not want them to come back because it is a high risk environment, and they are high risk patients. So our recommendation is that you communicate with your team and that you give them the option first of deciding what they want to do. And what that means is basically having a conversation with those that are maybe in that category that we were just talking about, older, pregnant, and immunocompromised, and saying, look, what are your plans? What's your desires? What do you want to do? We'd love to have you back. Tell me what you want to do. And then wait and see what they say. If they say, I absolutely want to come back, and I want to come back, full-time, 32 hours a week, then it's going to be hard for you to say no to that. If they say, well, I'm nervous and I'd love to work from home or go part-time or whatnot, then you'll have a little bit more options to play with. And so kind of be very mindful of that as this process, because it is a very sensitive time. And so just bringing back younger employees, just bringing back, your favorites and not bringing back everybody could potentially be a problem. Now, some initial basic items to kind of think about with the team. So I'm going to kind of go through a couple of things that are really important for you and your team to know. And this is sort of a combination of a lot of stuff that you guys have probably heard in many different kind of scenarios. And I just wanted to kind of summarize it so that we make sure we have a checklist of sorts for the team, right? So one is, we want to make sure, and this sounds basic, but it's, very few of us have been in a situation like this. So you want to make sure that the staff, the team knows the right ways to put on, use, and take off the PPE, okay, safely. There are the right way of putting it on and taking things off that won't spread, the aerosol and the things. And so you just want to have those, you want to have those trainings. And for those of you that are planning to open up, having a day or a half day before you open up to kind of go through this, or even the morning of maybe the first day where you're not rushed but you have a good amount of time to go through that with them is probably a good idea. Now, recognizing the symptoms is very important. There's a lot of symptoms that keeps getting added on to, but the basic ones are fever, cough, shortness of breath. Okay, those are absolutely sort of the core. There's a lot more that the CDC is coming out more and more frequently with. So what the law now says, as you guys have heard me say before, is that you have more flexibility with regard to asking questions about the coronavirus and these items and other items that the CDC recommends you should be asking about. So just kind of keep that in mind. Having a strategy, implementing a strategy to immediately triage and handle sick employees. Okay? Very important, because if your employee comes in and they show signs of this, or let's say you forget to take their temperature and by lunchtime you realize that they are over 100.4 degrees and maybe they're sick and they're showing some signs, what do you do? What do you do? You've got to have a plan for this, right? You've got to have a plan for this, because the reality is that most likely than not, you're going to have to shut down immediately. You're going to have to notify your employees and your patients that this person has been in contact with or around. And there's going to have to be a protocol, which may cause a longer term shutdown in your office if everyone who's there now has to be quarantined. So again, a lot of local rules apply here, but the CDC recommendations are still present, right? Are still present. So kind of just keep that in mind. emphasizing hand hygiene and coughing etiquette for everybody, of course. Asking your team to stay home if they're sick, right? Seems like an obvious thing, but when we are under financial pressure, when we need those paychecks to pay bills, especially after 2 months of not working, this is the time when people start to kind of try to hide and not really bring up these topics, and maybe they think they have the flu and not the coronavirus. It's all well intentioned. It's really meant to protect their own families and whatnot. But the reality is they're putting a lot of people in danger. And so make sure that you've communicated that to your team and make sure they know it's safe to stay home. They're not going to lose their job. They're not going to be reprimanded, that you understand why. Okay. And then if they're, like we talked about, sending the employees home immediately if they show any symptoms. Now, this is a big topic because what about forcing employees back too soon? Now, one thing I have to tell you that I have seen that I don't enjoy seeing, sadly, is on all this social media stuff, there's a lot of negativity, a lot of kind of bad interactions between all of us in the dental community. And it's really sad to see. And the only reason I can sort of say that this has happened is because of the high level of stress that's going on. And so we have to be mindful of having employees come back too soon. Now, instead of, like I mentioned earlier, instead of having employees all come back the minute the business reopens, you may want to have these conversations with your team to see one-on-one who's open to coming back and who maybe is not open to coming back immediately. And you may find that things kind of work themselves out because some people want to come back and they're okay, and some people would rather not, and then you're off the hook. But sometimes you might find that, let's say, all of your hygienists suddenly don't want to come back, and with all the information that we have out there, that may or may not be a reasonable thing to do. So you have to be able to handle that. You have to be able to manage through that. And so just kind of keep that in mind, because if you can start things voluntarily, right? If you can start things voluntarily, you're going to be in much better shape, right, than forcing them back immediately. And one of the things I'll tell you, that the reason I'm bringing this topic up is because we have seen letters from lawyers to our doctors saying very similar types of things, in their demand letters. And these are lawyers who are advertising and marketing to your current team, saying, were you terminated? Were you this? Were you that? Is your employer forcing you to work when you don't want to work? And so on and so forth. And it's causing a lot of stress. Now, we've been able to get rid of a lot of these kind of demands, and we've been able to fight them because a lot of them are bogus, but it's still a distraction. So as we talk in the next stage about mitigating risk for the team and the staff, we're going to talk about equipment and things of that nature. But I think having that conversation up front will minimize a lot of your risk. And also remember, making sure that you have proper screening measures in place for the team will be really great. And remember, we think there's going to be a lot of pent-up demand. We think patients are going to be hungry to come back to see you. They're going to be excited to come back. But it may be that your team may not feel that same way. And as we all know, we are nothing without our teams. And so working with them, with our teams, to make sure that there's a proper protocol for coming back will probably end up saving you a lot of stress. So now, shortchanging workplace safety, a huge thing these days. And I say this because there's a lot of there's a lot of things happening out there with groups that don't believe COVID-19 is real, groups that think that it may not be as contagious as it is. I'm not a scientist. I don't know exactly where the truth lies in this. But what I will tell you is that the governing bodies that matter the most, the boards of your state, right, whether you're dental boards, optometric boards, medical boards, whatnot, the CDC, OSHA, right? These groups that do have power over your office do believe COVID-19 is real, and they do have protocols in place. And so if you don't meet your obligations, litigation will almost certainly be the final result in your office. So just be very careful. Now, I understand, because remember, my own wife is a dentist, right? I get how hard it is to get PPE right now. And some of your state, associations are working very, very hard to try to get some of these for their members, but the federal government is coming in and seizing a lot of things. Then there's vendors who are not able to provide you with the materials. And then finally, there's the fake stuff that's coming in, the black market stuff that's coming in. So this puzzle is very hard, very, very difficult to manage. But you've got to do what you've got to do to not shortchange workplace safety as we move forward. And we're going to talk about some of those strategies now, but just remember, follow the guidance of CDC or OSHA. Now, I have to tell you, I am super, super disappointed in OSHA, because I was expecting and hoping and praying that they would by now, because it's been past their deadline that the FFCRA and the CARES Act kind of put in for them. They were supposed to put out new protocols in place for patient safety and workplace safety, but they have not yet, at least not as of right now. So hopefully in the next couple of days, they will put out much more specific information. But remember, you've got the OSHA, CDC side of things, which is the federal government, and then you've got a lot of the states making recommendations as well that they're going to put out information. So just kind of keep that in mind as you kind of think about it. But remember, put your own feelings and opinions aside regarding COVID-19, right? This is about your business. This is about your practice. These guidelines are not recommendations. They are going to be guidelines that you have to adhere to. And if you don't, as in before, it will be considered grossly negligent, and then you may end up having lawsuits to kind of deal with. So that, I think, is all I want to talk about as far as workplace safety goes for now. Now, let's talk about mistakes with health screening. So to ensure that employee temperatures are taken, it's important to make sure that you are taking them every single day. Okay, so every single day, every single employee that comes into your office needs to have their temperature taken. And we're going to talk about some things that you need to do with that in a second. And this is, this is allowed now. It wouldn't be allowed under normal circumstances, but now you can have these conversations, and you've got to be able to do this. Now, here's what you do with the data, right? What you do with the data is that you've got to save it in your employee files, right? You've got to save it in your employee files, and that's very important. That data needs to be there. Now, some of you may only be doing it or you may only be saving the data if someone's over 100 degrees or 100.4 degrees. And that's one way of doing it. But if you're going to take their temperatures every day, I would mark it and I would save it into their HR for Health file or in paper. Now, there's a lot of diagnostic tests that purport to identify if someone has COVID-19 or the virus or whatnot. And you have to be careful about some of those, because they may not be doing the job. They may not be real. And if these companies are charging you to do it, then that might not even be legal, because the CARES Act and the FFCRA have indicated that a lot of the testing for this should be free and should be paid for. And so that just kind of keep that in mind. Now, questionnaires that you have, there's going to be questionnaires for employees. There's going to be questionnaires for patients about their health. You don't have to do questionnaires every single day for the employees, but I think teaching them about the protocols and teaching them about what to look for before they come in and before you take their temperatures, I think is good. Those questionnaires we'll talk about in a second for patients is definitely recommended, and you should do that before they come in at any point. Okay, so let's go to inflexible work arrangements. Now, Now, when you open up, right, there's going to be a lot of social distancing mandates. Some localities have their own rules. Obviously, the state governments are going to have their own rules and restrictions. As I mentioned last week, we do think that they may require some floor plan changes in terms of how many chairs are in an open bay area and what the distance between the chairs are and things of that nature. So you may end up having to alter the office a little bit, or the layout or whatnot, adding plastic screens, kind of fiberglass type of stuff in retail stores in front of the reception desk that you may have. Those things are really, really important for you to start planning for now. I can tell you that more and more people are starting to do it, especially on the retail side. And so just make sure that you start talking to a vendor that can support you and can get it installed before you open up, because they may run out, right? They may run out. Some of these things come from abroad, and if the manufacturing abroad isn't operational, or they're delayed or whatnot, then you may not end up getting your plastic shields or whatnot. I don't mean the things that you wear, but the things that are installed on sort of countertops or in front of the reception desk or in between operatories. So, and if you don't have those, remember, it goes back to the previous slide about not sufficiently having things in place before you open up. Now, employees may want to experiment with different work days and work weeks. I can tell you that a lot of our clients are going to longer days, but having sort of a morning team and an afternoon team. You do have to kind of figure out, with overtime and other things, kind of how this works. But it's worked out really, really well with a lot of our clients. And my own wife, I found out yesterday, has started to do some of this, which they're going to have a morning team that's going to start at a certain time and end right after lunch, and then an afternoon team that's going to start kind of overlap a little bit and then go through the rest of the day. And the goal there, right, is that one, you get in front of as many patients as you can, because there is that demand and they want to come in. But two is that you are limiting the number of team members that you may have in place at any one time. So if you have a crowded office and whatnot, this allows a little bit more separation. Now, again, please communicate with your team members about this. Some may be morning people, or they may have kids, and maybe a spouse can drop off the kids in the morning, and then in the afternoon, they want to be off when the kids are off of school, things of that nature. So being conscious of those, I think, is really important. And then remember, have those communications. Don't commit to anything yet. Have those communications. Figure out exactly who wants to do what and what hours and how many days they want to work. Because remember, if they're only working like 6.5 hours a day now, they may need to work a fifth day just to kind of make up the same number of hours, even though they're working, just the morning or just the afternoon. So there is a science behind it. So it's not a bad idea to kind of play with that and kind of figure out what you need to do. Now, remember, on HR for Health, super, super easy to kind of coordinate all of this. So feel free to talk to your advisor. They will help you. Now, some questions that we get: what do I do if my employee refuses to come back to the office because they are making more on unemployment? And what's funny about this is I was absolutely expecting this for the normal team, because there are situations. I mean, the federal government is being very, very generous with their $600 a week, but it always surprises me when a doctor, right, when says it to their employer, right? They'd rather stay home than come in for their associateship position. So, but it is what it is. I mean, if an employee refuses to come back to work because they are making more unemployment, what are your options? And so here's kind of where things fall, right? If you have work available to them, right? If you have work available for them and you're opened up and they refuse to come in because of financial reasons for unemployment, then you can terminate them for that. Now, I'm not recommending that you do, but I'm saying that you could if that person refuses to come into work, right? Now, should there be communication? Absolutely, 100%. I think communication between you and them I think resolves a lot of things, because a lot of this is really, I mean, some of it is about unemployment, but the reality is that, you know, this new world that we're coming into is going to be very different than before. And so I don't think it's going to be the same situation with, you know, jobs being as scarce. I think there's a lot of large organizations, large practices around the country on all fronts, right? Whether it's hospitals, you know, optometric offices, veterinary hospitals, dental offices, physician offices that are letting go of a lot of team members. And so as a result of that, right, you know, there is going to be potentially a larger workforce ready to come to work. That being said, right, you can either terminate if you have the work, or if it's really for some other reason, like you know, they're just worried about COVID-19, then I think the communication will help allay some of those fears, because you can show them all the things that you've done to reduce their exposure and whatnot. And so that, you know, that is, you know, that typically ends up working. If it still does not work, you've got to decide how valuable is this person to you, right? How valuable of a team member are they? Can you hold out until there's a vaccine or some other thing that makes them feel more comfortable coming back? Or would you rather just separate right now? It's hard to say that, because I never, ever, you know, endorse termination. You know, HR for Health in our law firm, we were one of the few companies nationwide who did not recommend terminating when, you know, the March 16th week was rolling out. And I'm so thankful that we didn't do that, because unlike those that did, we put ourselves in a position where people are now coming back to work excited for their doctors, as opposed to feeling like they were just left out in the cold. And I still don't recommend that. But I think these communications, I think, are things that, you know, I think these communications will allay some of their fears, because the reality is that there are many reasons why somebody may not want to come back. Now, how do I document my employees' temperature? Well, you know, I think many of you know how to do it. You want to have working thermometers available. It's very important that you have a couple, because in case one breaks, you want to have another available for you to use. And so just kind of keep that in mind. I remember there's no reason to not have a couple of them. And then remember, document them. Now, can I delay the start of someone who is pregnant or older than 65? We've talked about that. The Department of Labor says no. You know, and this applies to anybody who's immunocompromised. So you still have questions, let me know. All right, so how do we manage patient interactions? All right, so here are some must-haves. All right, so here are the things that you absolutely need to have. So you need to have a front desk barrier with plexiglass or something similar. Okay, so front desk barrier with plexiglass, absolutely a requirement. Okay, open bay, if you have an open bay situation, potentially putting separations between the chairs, whether that's either leaving it empty or putting plexiglass, that's something that is being highly recommended right now. Having hand sanitizers coming in and going out of the office and operatories, highly recommended. Now, getting hand sanitizers is a whole different story, but making sure you have it coming in and going out is very important, and having it in multiple places, including where patients come in and out of operatories or lanes or whatnot. Make sure you have those available. Working thermometers, as we talked about, and then something that we sometimes forget about, but it is important, is pens. If you are having patients sign documents and things of that nature, you can do it one of two ways. Either you ask them to bring their own pen from home, okay, or you give them disposable pens or pens that they take with them. In other words, so, and remember, you don't necessarily want it to be in sort of a cup where they touch 50 pens and then take one. You know, you want to kind of figure out a system to get them a pen if they have to sign documents or whatnot. Of course, if they're doing it using a stylus, because you're doing things electronically, you know, you may have to, you know, cover the stylus and then replace the cover. But just kind of keep that in mind as well. There's a lot of places where you can just order pens. Contacting your insurance carrier about a 6-month recall waiver. I recently heard this. I thought it was great. You know, the insurance Companies may create a waiver about that and make an exception. So if you need to bring in some patients who are more at risk, that might be allowed. Having special hours for special needs and older patients or immunocompromised patients is not a bad idea. And so highly recommend doing that as well. Again, it's another way for you to show how much you care and what you're doing for your community. Now, things to do before the patient arrives. Let me go through this. So if your office has magazines, reading materials, communal objects, toys, you could do one of many things. Either remove them completely, which is probably the best thing, or clean them regularly, right? So keep that in mind. In the waiting room, please make sure your chairs are at least 3 to 6 feet apart when possible. Now you can have areas for families to sit together, but you know, if those seats are close together, which in most waiting rooms they are, then having them 3 to 6 feet apart is probably a good idea. Ask patients about their symptoms before they come in. So during the reminder call, which all of you should be doing at this point, is making sure that, you know, you ask them about symptoms, you ask them about what, you know, to ask them, you know, kind of how they're feeling, if they've been interacting with anybody who's sick, and things of that nature. Consider rescheduling non-urgent appointments. Again, you know, depending on where you are in the country, you may or may not want to do this. You know, some patients who are more high risk for caries and other things, you may want to bring them in sooner. You know, those that are not, you know, maybe you push them out even further. Assuming, again, remember, assuming that you are able to open up, right? So, for example, in the Bay Area counties here in Northern California, you know, the shelter in place got extended through May 31st, so you can't even technically do that. Know which one of your patients are higher risk for really bad outcomes because of COVID-19. So again, if you know their health histories, you know their ages and things of that nature, I think that's good for you kind of to keep in mind as well. Now, let's talk about what do you do after the patient arrives. Okay, so after the patient arrives, let's assume for the moment that they've been waiting in their car and you call them in or you text them and they come in. You want to make sure there's a staff member, one of your team members, they're at the door asking them about their symptoms. I know they probably were, you know, asked those same questions the day before, but ask that day before they enter in, take their temperature. Okay, you know, if anybody has any symptoms, right? You know, my recommendation is just, you know, send them away. But you can, if you want to still treat them, and if they are a high risk patient in the sense that they need the care that you're providing, then giving them tissues and face masks to cover their mouth and nose. You know, please limit non-patient visitors, especially a lot of you orthodontic offices, pedo offices. You know, you have people coming in wanting to just kind of hang out in your waiting room, maybe play video games and things of that nature. Just make sure non-patient visitors are not there. Maybe if you have a minor, maybe you have just one parent, not both parents coming in. If you can, in your offices, you know, this is especially true for our medical clients and veterinary clients. If you can, separate sick patients from non-sick patients. You know, if you can do that in your office, go ahead and try to do that. If your office is smaller, like many of our optometric and dental clients are, you may not be able to do that. Creating, like I mentioned, separate waiting spaces in the waiting rooms is important. And then putting patients who are sick, right, in private rooms as quickly as possible. Now, I am excited to tell you, I know most of you know this, but still many of you don't. The ADA has put out a toolkit on their website. We have it on our resource page as well. You can download it very easily. The ADA has an amazing toolkit that they put together that really acts as a great checklist for you. They have some sample letters and some other protocols. Please download that or get it from someone. It's a really great document to use. You know, and I know many of you have been worried about the ADA and what they're doing, but they are doing some great work here, and so just make sure you follow up. Now, let's go to equipment and whatnot. So let's talk about this, and then we'll end the N95 mask or the KN95 mask. So a lot of information out there about this. I want to go through it quickly because I know this is information that a lot of you have been asking on social media and other groups, and of course, please be careful about what you hear from different vendors. But here are the things. There is typically a fit test that needs to be done with the N95 mask. In other words, you need to have a independent person, in essence, tell you and come to your office, check all your employees, and make sure that the N95 mask fits on their face and really kind of covers them. That has been temporarily waived by the federal government, so you don't need to do a fit test necessarily right now. And the ADA has confirmed this with me. So you should be good. You can do that now. You do need to do a self test. And what I recommend is that all the doctors on the call today, please make sure that you're doing a test, not just for yourself, but of course of your team members. And so to make sure that you're doing those on a daily basis, just make sure it's covered and that it's complete, because anything that's open, allows the aerosol and the droplets and whatnot to potentially go in. It's important for this education to happen, because if the employees don't know that how the fit works and how it protects them, then they might be less willing to do it. Obviously, facial hair, things of that nature need to now be shaven. You need to be shaven so that the mask fits properly. If your employees have heart or lung conditions like asthma, please be very careful with the use of these masks. Make sure you're discussing it with them. Make sure they discuss it with their physician, because these masks have been shown to strain their condition. We have heard about runners and others who are out wearing these masks, although you're not supposed to wear them when you're exercising, but they're wearing them when they're exercising, riding bikes and running were the two that happened. And they got very sick. They got very sick and almost passed out. So just kind of keep that in mind. The CO2 levels can increase, if someone's wearing it. And so educating them about that and making sure that they're aware that if they start getting dizzy or have other symptoms, that they need to notify someone and to be careful. Now, some other interesting things about this, because of the shortage of the N95 masks, there's a lot of talk about, well, what do I do? I can't get my hands on some. Now, if you don't have masks or you can't afford to get as many masks or whatnot, there's a couple of things you got to know. The federal government has now said that you can reuse the masks if you've got a covering in front of them, like another face mask, right? Like a cloth face mask, and you just kind of replace the cloth. But here's the other thing that was very interesting. They said that if you've got expired face masks, in terms of their expiration date, that those are still better than cloth masks. Okay, still better than cloth masks. So I wouldn't, as long as they're NIOSH kind of approved, even if they're after the expiration date, you can still use them. This is the government's way of making sure that there's enough masks moving forward. Okay. All right. Making sure that the integrity of the masks are there. Of course, check all the components, the straps, the nose bridge, the nose foam material, all of that. I think that is very important to make sure that those are in place, because if they get damaged, then they're not as useful. Scrubs, wearing a surgical mask over your N95 mask, totally approved. You can take the surgical masks off. If you're wearing scrubs under a disposable gown, that's probably fine as well, they've indicated, as long as you don't leave the office with your scrubs. You can get them dry cleaned or washed or whatnot there in the office. If you go between operatories with your scrubs, it's very typical these days for that to happen, but that is sort of an infection control violation. Just know that you need to kind of change old behaviors, and so wearing a gown over your scrubs is totally fine and approved. But but if you have your scrubs, you should be taking them off before leaving. Now, this is I want to talk about SARS-CoV-1 and SARS-CoV-2. The reason I want to make this kind of quick statement here is because there's a lot of folks trying to sell you stuff, and they're putting SARS-CoV-1 on there, and it's not necessarily a COVID-19 thing. So what I just want to tell you is that SARS-CoV-1 is really like the old SARS that we dealt with, 10 years ago or whenever it was. And SARS-CoV-2 is the technical name for COVID-19. That's the virus that leads to COVID-19. So just know the difference between these two as you're looking at materials, because if somebody's trying to sell you something and they're selling that it's SARS-CoV-1 compatible, they may just be making some statements that may not be true. Isolite versus L filtration. Gordon Christensen has come out and said that studies have shown that isolite doesn't seem to work to control aerosol. So just kind of keep that in mind. I have no knowledge of this. This is his studies. But as you all know, his research and whatnot has shown that, air filtration works better than isolite, especially if you crank up the air filtration to the highest air exchange you can. Then you're in better shape than using isolite. Now remember, you can buy air filtration systems for each operatory, open bays, various rooms. If you've got a really powerful HVAC system, then that could be okay as well. All right, now let's go through some final thoughts. We are going to post a poll right now on your screen so that you can give your feedback on some questions that we have. But I want to go through it while that's kind of coming up. So here are some final thoughts. One, please contact HR for help if you do not have your HR house in order. New hire documents, employment manuals, protocols for bringing the team back, how to manage them. If you need to terminate somebody, make sure you are absolutely doing the things you need to do on the HR side. This is the time to get your HR house in order, right? TDIC, if you are in a state where TDIC provides insurance, please contact them and make sure you talk to them about your insurances. You may need to up some coverages. If you're not using TDIC, just contact your insurance broker and ask them what policies you need to have and whether your amounts are sufficient or whether you should increase them. The ADA toolkit, we talked about that. All right, make sure you download that. A wealth of resources there. If you get a demand letter, do not be scared and do not ignore it. Send it to us. We will answer it for you. We will respond to counsel and put them in their place. A lot of these are fear tactics. They are advertising heavily right now for your employees. And if you respond strongly and you've done the right things, these things usually go away. So make sure you don't ignore those. Now we are going to starting next week, some special webinar series with Q&As with industry experts. We did one on Monday. It was absolutely fantastic. And we're going to continue doing it with other experts in the industry, great CPAs, consultants, other folks on the insurance world, and other special guests that I can't reveal just yet. But we are going to do it in Q&A fashion because what we found is that it really absolutely gets you the best information. Remember, refinance your existing loans. If you've got anything above a 4.5% interest on any of your loans for the practice or your buildings, commercial or otherwise, refinance now. It is a great opportunity to set yourself up for the next 10 years. If you are more mature in your practice and you are thinking of not returning because you're afraid of COVID-19 and you want to transition or retire, please let us know. We will help you kind of navigate that or introduce you to someone who can. There are a lot of young doctors, veterinarians, optometrists, dentists who are looking to buy offices, who are looking to start from scratch. They understand that this is going to be temporary, but they are ready for you. So if you're thinking of doing that, please let us know. Here's my contact info, our office phone number, my assistant's email if you want to email and set up a time to chat and strategize. So I know we've gone long, but I appreciate all of you. We do have some Q&A stuff, but we will answer these separately because I've already taken a lot of your time. So I appreciate all of you. Be safe, be well, and I hope to see you very soon. Take care. Bye.